Hi, I'm Debbie Callender, and today I want to talk about what caregivers should check after a fall. After a fall, people often focus only on the moment itself, but if we want to help prevent the next fall, we need to understand the bigger picture. This is really about asking better questions and looking at the situation more clearly. After a fall, it is natural to ask what happened. But one of the most useful questions is often, what changed? Falls are often not random. Usually, something has shifted in the person, in the home, in the routine, or in what was being asked of them. So, after a fall, we need to look beyond the moment itself. One of the first things to ask is, what was the person trying to do? Were they rushing to the bathroom? Were they trying to get up from a chair that was too low? Were they reaching for something? Were they walking in poor lighting? Were they moving without enough support nearby? That question can tell us a lot because the activity at the time of the fall often points us towards the real issue. Next, ask what changed before the fall? Sometimes the fall is not the first problem. Sometimes it's a sign that something else has changed. Did strength change? Did balance get worse? Were they more dizzy, more tired, or less steady than usual? Was there a recent medication change? Did their confidence change? Were they more confused than usual? These are the kind of changes that can quietly build up risk over time. Then look at the environment. Walk through the space with fresh eyes. Is there enough light? Are pathways clear? Is the bathroom easy to reach and set up safely? Is the chair or bed too low? Are important things easy to access? The home environment plays a major role in fall risk, and sometimes small changes in the setup can make a big difference. Then look carefully at the person. Has there been a change in strength or balance? Has vision or hearing changed? Has medication changed? Is there dizziness? Is there urgency, especially rushing to the bathroom? Has cognition changed? When we look at the person as well as the environment, we get a much clearer understanding of what may be increasing the fall risk. Now, all of this can feel overwhelming. But you do not have to solve everything at once. Start by understanding the fall better. Gather the details, ask the right questions, notice what may be increasing risk right now. Then start with one practical change. One step at a time can make a meaningful difference in safety. This is especially important in dementia care. In dementia, several things can affect safety at once. A person may be more disoriented. Their judgment about what is safe may be reduced. They may not notice environmental hazards. They may rush because of urgency. And they may not be able to communicate discomfort or dizziness clearly. That is why in dementia care, understanding the context of the fall matters so much. We need the whole picture. If you can understand the fall more clearly, you are in a much better position to help prevent the next one. Sometimes the fall is not the first problem. Sometimes it's a clue that something else has changed. So the goal is to understand what happened, identify what has changed, and reduce risk in practical ways. It doesn't require perfection. It requires attention, curiosity, and a willingness to look at the whole picture. If you would like practical support, tools, handouts, and caregiver guidance, join the Care Caribbean community. If you missed part 1 of the Fall Prevention Calm Care Spotlight, you can watch it on the Care Caribbean YouTube channel. And part 2 continues on Thursday, June 25th, 2026 at 6:30 p.m. You can scan the barcode on this slide to join the community and stay updated, or use the community link in the description to this video or post to register for part 2 and access caregiver resources and handouts. Thanks for listening. Bye for now.